A very good evening to everyone present out there today. Today's live session is based on back pain. That's one of the most prevalent pains that people are facing these days due to the pandemic. According to the reports published by Acute, about 8% adults face back pain on an average. And in fact, according to another report suggested by Acute, doctors have witnessed a spike in back pain and obesity in e-learners and people working from home. Now, giving you a bit of introduction about our Physioveda Medical Center, it is one of the best home care providers in UAE, and we've got a professional team of physiotherapists and doctors to help you cure. And today I've got Mr. Amit with me, who is the CEO of Physioveda, and he'll be providing you with proper details regarding back pain.
Hi Malika, how are you? Hi all.
I'm great, Mr. Amit. How are you doing?
I'm good. How are things going on?
Things are going good. I mean, the pandemic is still going on, not bad. And apparently everybody has been seeing a spike in back pain and a lot of muscle issues due to less movement and stuff like that. So thank you so much for coming here today, and I hope that you can give us some nice insight about stuff like that.
Yes, we'll do that.
Alright, lovely. So as you know, today's session is based on back pain. Mister, I would like to ask you, what are the most common causes of back pain?
See, when we talk about pain, pain is a sign of injury or any inflammation going on in your body.
Right.
It's the first sign that you feel it by the body, right? So anything regarding your back pain, if we go, back is divided into three parts, right? Upper back, middle back, and lower back.
Right.
Maximum time we were getting lower back and upper back issues. Middle back issues are rare, but it is there.
Right.
Nowadays it is more because in the pandemic we are sitting at home, online classes is going on, online work is going on, so we are sitting for a long time, long hours, either on the computer or on iPad, phone, so it is. And as you said, according to Khalistan News, that 80% of people have faced back pain during their lifetime. It's actually correct statement.
Right. Right. So I'd also like to ask, what are the daily things, our day-to-day things that we do that are, that cause back pain? Like it could be like daily habits, like driving, or just being at home and
What
following
happens is either any counts in by the injury. If you got a direct hit or a road traffic accident or accidentally or sudden movement, any injury can cause back pain. One more thing is when the muscular imbalance creates in your body and it strains your back. That's the major reason nowadays we are facing.
Right. All right. So, Mr. Amit, we've actually got a few questions from the public, which we received a few days back. We have tried filtering a few questions for you,
Yes, not a problem.
and I would like you to address those questions for us. All right. So we've got a patient saying that I've got spondylitis. What is the most effective and fastest treatment for my problem?
See, spondylitis, anything where itis is there, it means it's an inflammation around the joint. So when it is spondylitis, it is basically cover the spine. So it can be a lower back or a upper back where the issue is. But yes, they have to go for a medical intervention if they are feeling something like that, because medical people can assist them and guide them what to do it properly so that it will not continue.
Right. Also, there's another question that comes to my mind, and I think many people have been confused about this. Is spondylitis something that has, been inherited?
Spondylitis, there are certain diseases which can be inherited, but not all.
Okay.
But they have to check with the doctors and the medical profession, get the intervention from the medical team so that they can assist you and guide you better on that.
Right. It's becoming very frequent these days, by the way. We have been getting a lot of patients complaining about it.
See, back pain, actually, if I talk about lower back pain, everybody who is sitting for a long time, running, or if your technique is not good in any sports, gyms, it's very common. Because we are sitting at home watching on the computer, working on laptops, so that way muscular imbalance come in. Back strain is very common in that.
Right, doctors. Moving on to the next question. I'm a new mother and have been recently feeling back pain due to carrying my child for long hours. Can physiotherapy help?
Yes, physiotherapy can help because we have a protocol in physiotherapy. It's prenatal and postnatal. So before the delivery, we have a prenatal set of exercises which you can do it, and postnatal, as soon as your doctor advises you, you can go for a physiotherapy session. You have to start because that way we can work on your imbalances in muscle power. And yes, you're carrying, maybe your technique of picking up the baby is wrong. So we teach you how to actually carry the baby, how to feed the baby.
Right, and I think, Mr. Amit, that in the long run, it can also cause postural imbalance, if I'm not wrong.
See, any pain you're carrying for a long time, it involves other joint as well.
Right.
I have got a patient in the clinic for physiotherapy who has ankle pain 6 months back. That pain is gone, but now he is having a back pain. But when we checked it, because of that ankle sprain, his muscles are tight. So that strained the back.
Right. And moving on to the next question, it's from an air hostess. She says that I am an air hostess and I have to wear high heels while traveling. Can physiotherapy help me in my back pain?
Yes, because high heel, if you're wearing a high heel, then your body mechanics changes. The angle of the joint and the muscle is changing, right? So in that condition, yes, your some muscle gets tighter and that's straining back. It's very common for that. And the main is when you are in the flight and all, you are in a bubbly thing, right?
Right.
So when you are in that, it's muscular imbalance is created for a long time.
Right. All right, moving on to the next question. This is by student. He says that I'm an online student. I have been facing back pain due to using computer for long hours. Do I need to consult with physiotherapists? Now again, e-learning and working from home issues.
No, it's because of if you're suffering with anything, please get the medical intervention as soon as possible. Maybe your chair which you are sitting or your position is not. Because there are certain rules which we follow ergonomically, how to keep your phone out, how to,
Right.
that way they have to check it every day.
Right. Especially students these days, they have
Yes.
to sit online for long hours and then do the
Recently
assignments.
when we were studying and all, then that time at least we have a movement, we have exercises doing it. But right now, lack of exercises, lack of muscle movements, this is very common.
Right. All right, moving on. There's another lady saying that I am 6 months pregnant. Can I still do physiotherapy? Now, again, Mr. Amit, this is a very frequently asked question. If it's safe to do physiotherapy during pregnancy. So, if you'd like
See,
to
and if we talk about pregnancy, then we, as physiotherapy, we have a prenatal full set of exercises according to your pregnancy months. We have all that in prenatal, and then postnatal, we work on that. So there are exercise programs for that, so they can contact the physiotherapist as soon as their doctor allows.
Right. Moving on. It's from a gym coach, and he says that I'm a gym coach. I was experiencing pain in my right shoulder, which is now extending towards my upper back. Will physiotherapy help?
See, if we talk about gym trainers or any kind of sports trainers, what they do it is they do their own exercises as well as the full day in working, they're helping people. So when they are doing that, maximum time what happens is they continuously straining their muscles because they're helping 8 hours or 10 hours, they're helping one or the other thing, so they get that. So yes, it can be possible. You have to get the medical intervention as soon as possible. Don't carry the pain because the more you wait, the more muscle will get involved.
Right, agreed. And also, Mr. Amit, I have seen this, like many people believe that if they are going to the gym regularly, the gym exercises and physiotherapy exercises are the same. Like many people aren't clear on the concept that this could be two very different concepts. So if you just put some light on that.
Right now in pandemic, we have understand the value of fitness. So everybody wants to do the exercises. But yes, what is the difference between a normal exercises and a physiotherapy exercises? Because normally you can do your all exercises, you don't need anything. But if you need a specific reason, if you are a baller, if you are a golfer, if you are a gym trainer, or according to your occupation, according to your need, physiotherapists decide some exercises protocol for you. So that's a tailor-made exercise protocol for you.
Okay.
Its gym is different, and this physiotherapy exercises are basically tailor-made for you. According to your muscle, which muscle is tight, you have to stretch it more. Which muscle are losing the strength, they put or a weakness, they do the exercises, the leg exercises for that. So according to, so it's basically tailor-made.
Right. So I think we've got another question coming from a live. There's Jyoti Yadav asking what to do to avoid pain related to high heels. Again, it's the high heels and back pain.
See, what happens is if you are doing it's occupational hazards basically for them. So if you are feeling that, you have to check with the medical profession or start some stretching, some walking without heels, because you need that.
Right.
Because continuously 4 hours, 5 hours you are on that heel, definitely your muscle and biomechanics changes. So check with the doctors or medical profession so that they can tell you the better way, because I don't know how much your muscle is tight, but yes, stretching is must.
Right. Also, Mr. Amit, I feel that sometimes not just high heels, even if your footwear is too flat for that reason, sometimes even that causes, pain in your muscles if you're like on very flat shoe wear for a long time. Isn't that?
Yes, it is happening because we believe it's 1 to 2 inches heel is necessary, because when you go on walking and check that walking pattern, that time the first thing which hit is your toes, right? Then it comes to heel, and then it goes to upper body.
Right.
But if you are wearing a flat shoes, your heel hits first. So either your shoe is loose in your feet, same thing will happen if you're wearing a flat shoe or a flat feet. The same thing happens. So you have to work with the physio or your medical team to cure that.
So I would say that be very, very careful about your shoe wear. It's very important to cure almost all your muscle aches.
Right.
Right. So moving on, there's another question that says, does back pain cause posture imbalance?
Any pain if you are carrying for a long time, because what happened is muscle spasm is our body's response, right, to save that joint or an injury. So when muscle spasm comes, and if you keep moving in that, the muscle involvement will increase. And if the muscle involvement will increase, definitely some muscle will go in tightness, others are stretching, so imbalance will be created. So you need a posture correction that time.
Right. Also, I would say that posture correction is something, a posture in itself is something that we don't pay much attention to on a daily basis, isn't it? Like, for example, I remember when initially I thought that I have a fine posture, but when I actually had back pain and I actually approached a physiotherapist, and then they took an assessment and then they told me that, all the imperfections in my posture, I was amazed because, you usually don't think that you could be having a posture imbalance.
In old days, our parents used to say that straight.
Yeah.
Right. Do the right posture, carry the weight in a proper way.
Right.
They used to say, right? But nowadays that gadgets are coming, we're sitting, but our movements are less. Yes, we are getting into that.
Yeah.
Because muscular imbalance is one part, and that it goes to posture imbalance.
True, especially post-pandemic,
Yes, it is.
It's been increasing now. All right.
A lot of studies are coming in, lot of countries about this now.
True, it's been given more importance.
More
I would
importance
say,
now.
yeah. Moving on, when is the best time to start with physiotherapy post pregnancy?
As soon as your doctor permits, because they are the first person who started and who are under UR, who's an observation, right? So they can the better judge to when you can start.
Right. So moving on, there's another patient saying that I'm experiencing back pain since 6 months. It comes and goes. Is it normal?
See, what happens is if you're carrying any pain for a long time, right? If it is coming and going, it means the time you strained it, it came up, and the time you relaxed, it went. So it is actually indicating you that some muscles are getting into a problem. So you have to go and check with the medical supervision so that they can guide you what is happening with you.
Right. Also, I believe that many patients, they leave the treatments incomplete. Like after a couple of treatment sessions, they stop it and then they kind of again, witness the pain again.
See, it's always in medical we say complete your treatment sessions.
Right.
Either it's a medication or any treatment in medical, we say complete your things, because if you not complete it, it will come back.
Right, agreed. Alright, moving on. So this is by a cricket player. He says, I'm a cricket player. I have been experiencing lower back pain recently and cannot play comfortably. Do I need to see a physio?
Yes, you have to. Maybe you are doing a less stretching or some technique which you're using in your field, right? Maybe in that you're missing something. So get in touch with the physio of your own team or outside, but get in touch with the medical team at least.
Right. Alright, moving on. There's another person saying, I'm suffering from disc prolapse in lumbar area. Will I ever be able to bend my back?
Yes, you can, but you have to be under the observation of the team, carrying orthopedic surgeons and physio.
Right, moving on. So there's another patient saying, when I breathe deeply, I get pain in my upper back. Do I need a consultation?
Yes, you have to go and talk to the doctors, because maybe when you are breathing heavy, you're breathing deep, your muscles are maybe muscular it is, or maybe some other underlying cause. So get in touch with the doctors, they will guide you better.
Right.
But if it is muscular, then physiotherapy is the best way.
Right, agreed. Moving on. I'm having cramps in my back while sleeping. Is there a physiotherapy treatment for this? Now, I think this is something very common again. Muscle cramps, while sleeping, be it in your legs or back. So, what do you
See, first thing is you have to go and meet the doctor, because muscle cramp normally comes by because of some deficiency. Maybe you are drinking less of water, maybe your some B12 or something is going down. So you have to check with the doctor, get your blood test done, so that we come to know what is happening in you.
Right. Okay, moving on. I'm suffering from disc bulge. Will I ever be able to get back to sports?
Disc bulge is not. Disc bulge nowadays, because we are sitting for a long time, no physical exercises or less physical exercises, the disc bulge is normal. You can get in touch with the doctors, medical team, they will work on it, and you will be perfectly fine.
It's like every other person these days coming up with disc bulge issues.
Yes, because see what happens is around your spine, disc is basically a shock absorber. Right. So what happens is that the muscle in that area becomes tight, so the pressure on the disc increases. And if the pressure on the disc increases, definitely you will get a disc bulge. So it's not a very big problem, but if you get in touch with the medical team, they can handle it easily.
Okay, so Mr. Amit, do you think that the work from home trend or the e-learners, trend that we were talking about earlier has a role to play in this?
Yes.
Yeah.
If you're sitting for a long time, we say every half an hour, 40 minutes, just get up and walk.
Yeah.
Do certain exercises. If you're sitting for a long time, just walk, do stretching, do little movement, because if you're sitting for a long time, so much time, definitely the problem will come. So either breathe in, breathe out, and better to check with the team, because medical team will guide you better with what you need, because it's a tailor-made exercise programs,
Yeah.
right, for your needs actually.
Right. Alright, moving on. So we've got another question saying, deadlifting at the gym has caused me back pain. How can I get rid of it?
See, anytime when you are in gym, first thing do remember is you have to do the warm-up and the cool-down. That's we miss always, right?
Agreed, yeah.
If you are doing a proper warm-up or a proper cool-down, muscles will be in a good condition. And yes, if you are lifting any weight, please check your technique. Because if you are lifting a weight in the hand and by the time you turn your neck will get a problem.
Agreed.
Because one muscle is working and the other muscle will come on that, and that way the problem will start.
Right. Alright, so moving on. Now this is from a person who has been driving more frequently, and I think again this is something that is very common in Dubai, UAE and traffic in UAE and
It's everywhere.
driving.
Everywhere in the world, the traffic is, yes, it is much more. Dubai is much better, I tell you.
Really?
Dubai is much better. If you go to other places, traffic is actually crazy. What problem is in the car, basically, when we sit, we don't adjust our seat properly.
Yeah.
So please, when you're driving, adjust your seat according to you. You have to be relaxed when you're driving. If you're not relaxed, or you are on the high, or you are sitting like this, straight, right, by the time any jerk will come and you'll get a problem. So whenever you are driving, please adjust your seat properly. You have to be in a relaxed position during the driving. Right.
Right, agreed. So this person is saying, I drive for a long distance frequently and I'm having a low back pain. Can I have a solution for this?
Yes, it can be easily sorted out. Get in touch with the medical team, because they'll check what is actually happening with you. If it is muscular, it's not a big deal. You do some set of exercises and adjust your little bit of. See, it's home care when we talk, right? Home care is not just going to the place of a patient, do the treatment and come back. Right? Home care means it's a rehabilitation basically. When we go to your place, we check where you're sitting, where you're sleeping, everything we check it. And according to you, we tell you the solution, what you can do it. Right? So that's actually a big thing.
Right. And we have done this in the past. We've got patients where we've gone to their home and we've kind of made them change their habits, and it's actually shown a lot of improvement in them, because subconsciously, even if we're taking the treatment, we do keep doing the same thing. It's in the house, it's the habits.
One person's daughter, she's 6, and she knows us as a person who changed his father's car. Right.
Okay.
So because he was having a very low car, and he was healthy. So whenever he's coming out from the car, because it's a low car, so he was getting the strain. So he suggests him to, if you can change, go to a little high car. It will be easy to come out and easy to get it.
Right. Yeah, I mean, agreed. Like daily habits and all this really does impact your muscles and your body. All right. So moving on. There's another person saying, I had a lower back pain which is now spreading to my right leg. Is it related to muscle or nerve?
See, you have to check with the medical team. You have to go for some investigation with the doctors, so that you have to meet because it's nerve involved now. When it is traveling down to your leg, it means your nerve is involved. So better to get in touch with the doctors. They'll do some X-rays, some investigation, what is happening with you, and then because physically assessing you and telling you is different. Maybe theoretically, like you're asking, yes, it can work, but what degree it is, right? How much damage you have it, and how you got it, right? Sometimes the muscle, everything goes through the muscle. So muscle is tight, your nerve will get damaged. But it may be from your back also. So you have to go and check with the medical team. They'll do some investigation and they'll tell you what is happening.
Agreed. Yeah. All right, moving on. Another patient saying, I recently lifted heavy weight and now I have back pain radiating up to my feet. What do I do?
Again, the same thing, they have to go and meet, because what is happening with you, unless the doctors will assess you physically, they can't tell you, right? We have to assess you personally, physically, then we'll guide you the solution. But it can be treated, it's nothing to worry about it.
Right. All right, Mr. Amit, now this particular question that I'm now going to mention is very important. It's a very common cause and something that people are very confused about at one point. So this question says, when is a surgery required?
See, whenever it comes to neurological deficit or a major injury, right? That also a doctor decides by your investigations, what we do at CT, we do ultrasound, anything. X-rays. So according to that, they go for a surgery. But yes, we have to investigate first what is happening. If it is muscular, no need to. Right? But it's still, the degree of injury have to be noted.
Right. Agreed. All right. So now we've got another question here actually. So this patient asking, I have back issues for quite some time. Will I be able to get back to sports?
Yes, you can. You have to get in touch with the medical team first. Because physically, without assessing you, telling is different. But yes, back pain, if it is not the third-degree damage or something, it can be recovered.
All right, so we've got another last question out here. It says, how to maintain my back health in my day-to-day life? Now again, this is very important. You know.
It is. See, doing exercise is needed.
Right.
But how much exercise and what is the your goal to achieve, depending on that. Right. Everybody, you do little breathing exercises, no problem. If you go little walk, no problem. If you do little exercises, no. But if you are advancing in that, please get in touch with the medical team so that they can tell you how and where you have to do and what kind of exercises you have to do.
Right, agreed. So any more tips you would like to give our viewers regarding back pain or any sort of muscle pain?
See, anything if you talk about posture and pain, first thing is you have to start doing little stretching of your muscle, little PD exercises. That's very little. But start your day with that. You do exercises, you will be perfect. But yes, if you are getting any pain, get in touch with the medical team. Don't wait for long. If you wait for long, the muscle involvement will be more. The doctor have to work more.
Right, agreed. I think this is what we do very often. We see a pain, we kind of go for home remedies, you know. We kind of try to put some muscle relievers and we try to take more painkillers. And, you know, we kind of usually avoid it on a regular basis.
Pain, I'll tell you now.
Yeah.
What happened is, pain is like a person coming to your home and ringing the doorbell, right?
Right.
The same thing happens, like a problem comes to you, give you a sign of pain.
Yeah.
If you are not checking with the medical team and you are having your pop-up the over-counter pills without any information, yes, for a long time it will. You have it one time, if it is coming again and again, get in touch with the doctors or the medical staff so that they can cure it properly.
Right.
Because if you are fit, everything is fit.
Agreed. So yeah, again, like, so it's better not to avoid your pain. It's better to like immediately take treatment for it and approach doctors. Because like Mr. Amit said, that any pain endured for long, you know, it causes more harm to you. So I think we would like to suggest that if you are facing any sort of pain, if you have any sort of muscle ache or anything, it's the best that you approach the doctors ASAP and get your pain treated today. So, Mr. Amit, now we would like to conclude the session. Thank you so much for your time. Thank you so much for enlightening everyone regarding back pain. I think we should wait for a couple of minutes if you...
Yes, you can.
Great. So, okay, let's see if we've got some questions out here.
Somebody is asking about posture, what is the right posture, what is the wrong posture, right?
Right. Well, I think you can tell us a bit about it as well.
See, posture is when you're all the muscles, all the joint, when you are doing anything, there is a certain technique or certain way of doing it. If you change that, if one muscle has gotten tired, because according to, I'll go to the layman language so that you understand. You know how gravity pulls the body. So there are certain muscles who works with the gravity. There are certain muscles who works against the gravity. And third one actually supports both the muscles. So what happens is the muscle who is working with the gravity works throughout the day. And the muscle who is working with the gravity doesn't have to do so much because already gravity is doing its own work.
Yeah.
So the muscle who works more goes into overuse weakness, and the muscle who is not doing anything, right, will become tight.
Yeah.
So that way the joint motion is impacted. The biomechanics of your body got impacted by that. So posture is impacted. Posture is not one joint. Posture is overall your body. How you are sitting, how you are walking, how you are doing anything. If you are sitting on computer, what degree you are high, you are making it high. Like I use my laptop, I always use a mouse with it, right? So that my hand will be in a rest position.
Right.
So that way we have to understand on the biomechanics of the body. And if biomechanics is good, everything is good.
Right, agreed, Mr. Amit. We've got a few questions out here. So there's one person asking, I have neck pain during driving. What can I do for it?
It means, again, I come to your this thing,
Same questions.
your seat is not in a right position. Get your seat corrected. First thing is fix it as you are in a rest, right? Like you're sitting on a sofa. And if it is there, please get in touch with the medical team. They will sort it out. It's not a big deal. Pain, if it is muscular, can be handled easily. If there are underlying diseases, medical treatment is there for that.
Right, agreed.
Right now we got in I think Kali's time it came some boxer got treated for a cancer thing in Tamil Nadu.
Okay.
So there are treatments. Doctors are much better here. You can get in touch with them.
Right, agreed. Moving on, there's another question. There's one person asking, my niece keeps complaining of back pain and stiffness post her college sessions. What does she do about it?
What's the age of the patient?
It's not mentioned, but I'm assuming it's a college student. So
See, again, same thing. You're sitting for a long time, and obviously the kids are not worried about how they're sitting, what they're doing here. They don't listen actually. So yes, get in touch with the medical team. It's not a big deal. It's for the kids. It's because the movement is lacking, lockdown. They can't go out running, exercises because as a kid we all do, right?
yeah.
So if a kid is getting chance to go out, play, the muscle at least pump. And when they are sitting idle for a long time, obviously the muscle imbalance comes in.
Right. Great. So, right, we've got another question out there. can postural imbalance create back pain? I think this is very similar to
It's
what
the
we
same thing,
addressed
vice versa.
earlier. Yeah.
Vice versa.
Yeah, right, agree. Another question. I have back pain since 3 years. Can physiotherapy help?
Yes, it can.
Right. Again, Mr. Amit, it's the same thing, like people carrying on pain for so long, I mean, years
Yes.
and years. So, I think it
See what happens is if you're getting any knee pain, right?
Right.
You're not putting a pressure on that knee. You're putting a pressure on the other knee. So even if it's cured, you're not putting a proper pressure on that.
Right.
Right. So if you're not putting that pressure, the one side muscle will go in one side, whatever day. Because you have a habit of putting that.
Yeah.
Right. So that way things works. So
Yeah.
ultimately you have to work on it. You have to get treated. If it is any problem, you have to get treated as soon as possible. If you do that, the problem will be
Right,
sorted
I mean,
out
these are
soon.
the habits that we build for us subconsciously, you know.
Yes.
Subconsciously, we're just in that same lifestyle, and subconsciously, we're kind of carrying the same format each day. And again, I mean, if you don't kind of change that, again, the pain would recur, you know.
It will recover.
recurring.
It will definitely reoccur because
Yeah.
you are not sorting out the issue. You are just
Exactly.
getting it.
Yeah. I'm extremely proud to say that at Physioveda, like Mr. Amit mentioned earlier, we don't just have a home care, but we do have home rehabilitation where we actually go and see the details in your lifestyle, like how you're sleeping and the position of your car, chair and stuff like that. Those little things actually we don't even notice that make such a huge impact on our body.
Yeah,
our
because you're
muscles.
sitting on a chair for at least 6 hours.
Yeah, very easy.
You're sleeping in your bed for 8 hours.
Yeah, exactly. You're driving for like hours, at least 1 or 2 hours, actually
Yeah.
more while coming and going.
It depends.
down.
It depends on
Yeah.
where you're working, what kind of work you are. If you're a salesperson, you're out in the day, so
Right.
you're driving more. If you are IT person, you're sitting a long time. So that
Even
way.
the delivery people, they have their bags in their back all day, and I must
One
say.
major thing is when one more question came in.
Mhm.
The lady is asking that one side bag she's carrying and she's getting
Yeah.
pain.
Yes.
Right. See, that's where the thing come and why you have to take care of. On one side you're carrying a heavy bag. So obviously that side you have to pull it up. So again when you pull it up, your muscle is tense.
Mhm.
So keep shifting the weight on both the shoulders so that the both muscle will work. If one muscle will work, definitely that will be a problem in long term. You'll get an strain on your neck easily.
Right. Okay, we've got another question. I have rounded shoulders and it seems bad, but what can I do to correct rounded shoulders?
Rounded shoulder becomes because you are sitting for a long time or means basically or you are not doing the stretching properly if you're going to the gym. It's common in that one muscle we train more. Like we go to the gym and we do dips more
Right.
than the back muscle. So obviously one side muscle will be more powerful, they will pull you.
Right.
So you have to get in touch with the team and they'll handle it because it's
Right. Also, Mr. Amit, the rounded shoulder, is it something that can be treated?
yes, can be treated with proper
Right.
exercises, proper assessment, it can be treated.
Right. And what could be the exact or maybe just approximate time period?
See, time period always depends on what condition you are.
Okay.
Right. How many muscles are involved, how things are happening, what kind of work you are doing it. Because exercises you do 20 minutes, 25 minutes, half an hour, 1 hour. And other things, like you're sitting on a computer for 8 hours.
8 hours. Yeah.
Right.
Yeah.
So how you think that 1 hour of muscle exercises
Could
can give
compensate
compensate for 8
8
hours. Right. You have to be doing certain exercises by that time also.
Okay.
Major exercise you did it in the day and the night, and when you were sitting for a long time, every half an hour, stretch yourself. Right.
Right.
Now people are doing it. Amazingly,
Yeah.
now from last 2 years, I have seen people are more into exercises, fitness, that kind of thing. So people are realizing it.
Yeah.
The more you move, the more healthy you will be.
Right, agree. And even I've noticed that even in our medical center, I've seen that a lot of people are getting more aware about their posture.
Right.
We've been getting a lot of cases where people are, worried about the posture and they kind of want to get into the right posture. So I do believe, I agree with you that, these days people are, focusing a lot on their fitness, on their personality in general.
Because actually we stop and we think of what we are now.
Yeah.
Right.
Yeah.
And the more you are sitting, so now you are realizing what is actually happening to you. You got a chance to realize actually.
True.
So fitness is going high nowadays. People are thinking more towards exercises. But yes, I just want to say, if you're doing little exercise, it's not a problem. If you're going for a heavy thing, please have a proper supervision either with the trainer or a physio or any coach you know. Right. Be with them. That's the better idea. Because they'll guide you the right thing and right concept.
Right, so we've got one more question. How many sessions will require to reduce back pain?
See, it's again a tricky question. We have to just check it first, what is happening.
Right.
Right. It can be just SI joint strain, right? So it can be because of the muscle is putting a pressure on you.
And I think it depends from person to person as well.
Yes.
Everybody has different
Basically
body
how much
and,
in what condition you are.
yeah.
So, but yes, it can be treated easily.
Right, which is why we recommend tailor-made exercises.
No, actually,
Everybody
tailor-made
has,
exercises is
different,
basically we decide the goal, what you want actually.
yeah.
Right. If you want to sit for long, you are working. You want to play which game you want to play because every game has a different you. Right.
Yeah.
Different muscle activity. Some games needs more of running. Some games need your more of exercises for your shoulders. Muscle power have to be defined. So according to that, it is better to go with the tailor-made exercises either done by the coach or trainer or a physio.
Right, agree. Now we've got another question. How much does it take for back pain to get decreased? Again, we've got many questions with the similar context, like when will back pain get decreased, or what are the causes, and so I think it's the same, like Mr. Amit just said, like everybody's body is different and works differently and requires different exercises. For example, what might work for Mr. Amit might not work for me.
Yeah, it can be possible
versa.
because
Yeah.
the way you are leading your life is different.
Yeah.
Right. I'm running a lot. So when I'm running a lot, obviously the muscles will be in a different shape.
Right.
If you are sitting for a long time, the muscle will be in a different stage.
Yeah.
So we have to check it first, what's happening with you. Right.
Right.
As a medical center, you have to go with the physical assessment with the doctor so that you know what is happening. If it is muscular, it can be treated easy.
Right.
Just change in your lifestyle and day-to-day activities and things will be sorted out.
Right. So I'm just seeing if we've got any more questions before
Yes.
we put an end to the session. I think we should just wait for a while and see.
First check the voice is coming clear or not. They are able to hear. Because last time when we did it, there was some problem with the net issues was going on, so suddenly it stopped, I hope you guys can listen properly.
Right. So, Mr. Amit, in general, would you like to address something more about back pain in general? Maybe?
In general, I think I have covered all the topics, right?
Yeah,
So,
I mean, I feel
yes,
if you have
if-
anything specific, please shoot the question right away.
See, anytime you're getting any pain in your body, get it checked, right? I'm not telling you to be in panic situation, but yes, get a medical, seek a medical help, get to know your body, what's happening with you, right? And if it is initial stage, it can be cured faster. If it is advanced, like you are waiting for so long, your problem will be according to that. So please get it checked with the doctors or a medical profession so that the pains will be sorted out.
Right.
I think I'm getting some messages on my WhatsApp also.
Yeah.
Who
So,
Hmm?
not been able to enter in the live session.
Whose message is this? You can call them now.
It's actually about time as well.
Hmm.
So I think if anybody's got any questions, please feel free to message us on our Instagram, Physioveda UAE, or our Facebook, again Physioveda.
Even you can,
And,
even if you want, you can mail us
Yeah.
on admin@physioveda.ae.
Right.
You can mail us, you can be on Instagram, you can send on our handle, then Facebook also we have this facility, you can do then anytime you can ask. Feel free to ask actually.
Right, and we've even got home care services if you cannot really, make it to the clinic. We provide home assistance, and for booking your sessions, you can just give us a call.
But
Like Mr.
we
Amit
work on
said.
appointment base, so please
Yeah.
fix for the appointment as soon as
Possible.
possible.
Right, Mr. Amit, thank you so much for your time. Thank you so much for enlightening everyone about back pain, which I would say the most common problem faced by everyone today.
Yes, Malika, we'll be live again on the next Saturday.
Sure, of course.
Yes,
Right.
maybe if
With
if
some
you
other
feel-
pain, of course, because I think we pretty much covered about back pain today.
Don't worry, pain can't
So-
enter your lives anytime, it can't bother you. But do understand the value of medical thing because don't wait for a long time. Seek a medical help so that they can cure you properly and you can live your life happily without any pain. There is an old concept, there is a pain you will gain. See that
No
concept?
pain again.
There was a concept like no pain,
Yeah,
no gain, right?
no gain.
See, that concept was wrong. I would say it's wrong actually, but there is for something, right? It's not you are getting a neck pain for a long time and it's good, you are pain. No, you are not getting
Oh, in that context, no, definitely no.
You know, maximum time from the back pain is so problematic that you can't even get up sometimes from your bed.
Right.
Right? It's a simple issue, but
Yeah.
it makes worse when you are carrying it for a long time.
Yeah.
So don't carry it. If you have any problem regarding anything, call us on 800-8332. You can get in touch with our physio team and the medical team. They'll get you connected with the doctors. So,
Yeah. Thank you so much everyone for participating in the live session today. I hope that the session was useful and I hope that
thank you
we
guys.
have been able to enlighten you about the topic
Yes.
and been useful. Please do get in touch with us ASAP if you do require any form of treatment or guidance regarding any sort of muscle pain. Thank you, take care, be healthy and be safe. Thank
Yes.
you.
Thank you guys. Thank you for attending the things and asking so many questions. I think I've covered a lot of
Right,
the
we
questions
covered
now.
almost all.
So anything regarding this, you
Yeah.
can get in touch with us on the mail, on the Instagram, on our pages, or on your. We have a toll-free number that is 800-8332 and 800 home care as well. So bye guys, stay safe. Anything, call us, get in touch with us. We can help you out anytime, anywhere in UAE.
Thank you, good evening.